Hi, my name is Fiona Madre, and I'm going to be discussing the healthcare systems between the United States of America and Guyana. My goals are not only to compare them, but to compare their government programs to see if they instill and maintain balance between access, cost, and the quality of care. The United States of America. It is a constitutional federal republic composed of 50 states. It is 3.8 million square miles wide, the world's most ethical, diverse, and multicultural nation. It is also the world's largest economy by nominal GDP. They are the leader in scientific research and technological innovations. The United States healthcare. The U.S. does not have a uniform health system. They do not have a universal health care coverage plan. It was only recently enacted by legislation mandating that health care coverage is for almost everyone. Health insurance coverage is uneven and often minorities and the poor are underserved. The government sponsors programs that are designed to improve access for older adults and low income without the regard of inflationary effects on costs. In the past, the main focus was on tertiary prevention. Now it's on preventative care or primary and secondary. This is due to the fact that 40 million lack adequate health care coverage. Research now shows that the importance of screens and preventative care can increase the mortality rate. Guyana is a sovereign state. It's on the northern part of South America. It's included in the Caribbean region due to its culture. English is the official language. Majority are descendants from North India and South India. The present population of Guyana are ethnic groups originating from India, Africa, Europe, and China, as well as indigenous and aboriginal people. Guyana has a presidential representative of Democratic Republic whereby the President of Guyana is both head of state and head of government. Guyana's healthcare. It is provided by public and private suppliers. They endorse the universal health care system. Emergency care and hospitalization for major medical illnesses or surgeries are limited because of a lack of appropriately trained specialists, below standard in-hospital care, and poor sanitation. Now we're going to talk about quality. Quality. The quality of the healthcare in the United States. Studies show that about half of the Americans receive proper medical care and follow through with recommended care. Studies also show that a lack of involvement in primary and secondary preventative care is associated with preventable death. The quality care in Guyana is that healthcare is on the decline due to economy decline. Primary care is limited and not promoted. Hospitals also suffer from poor management, shortage of staff, and poor infrastructure, insufficient drugs, and medical equipment. This is because of many factors such as low income levels, a drop in education levels, and reduction in the health sectors to serve the needs of the population. Life expectancy in Guyana has declined from 70 years in 1985 to 1964. Maternal mortality is high as well. The leading cause of mortality for young children has been infectious intestinal disease, nutritional deficiencies, diseases of the respiratory system, disease of the blood and blood-forming organs, nervous system, and homicide. Malnutrition is a byproduct of high rates of poverty. Many individuals are uneducated and do not understand the importance of proper health and its impact on their lifestyle. Now we're going to talk about the cost to buy any drugs or to just seek out primary care. The cost of the healthcare in the United States. Citizens of the U.S. would spend about $4.50 per capita. As technology and revolutions change healthcare, providers have transitioned to a business-like approach to medical care. The United States healthcare system is very costly due to the multiple insurers. The physicians charge a lot so that they can compensate for what they invest in. The case study by Woolhander in 2003 also pointed out that the admin tasks take up 13.5% of the physician's time. In total, physicians' admin work cost about $72.6 billion, which is 26.9% of the physician's gross income. Patients pay 13% of all healthcare costs out of pocket. The rising costs foreshadow no mercy for these individuals, for their cost contributes to more personal debt and bankruptcy rates. Insurers give multiple duplicative claims and smaller insured groups more claims, which increase their overhead. Because there are so many hands on the claim, the provider raises their costs to meet with the multiple insurance products and to come out with a profit. Now the cost of healthcare in Guyana. The Ministry of Health is responsible for the funding of the National Referral Hospital. Other facilities get funding from the Ministry of Public Works and Communication and Regional Development. The National Insurance Scheme gives insurance for a portion of the cost. Dependents are not even covered. Private health insurance is an option. Now we're going to talk about access to healthcare. Access to healthcare is availability and timely use of personal health services to obtain optimal health. Having good access to care requires entry into the healthcare system, getting access to sites of care for services, and finding providers that will meet the individual's needs. Access. Now we're going to talk about access to healthcare within the United States. The uninsured U.S. residents had much worse access to care. They received fewer medical services and rated their quality of care low. Some factors such as race are shown in the mortality rates, for there is a wide gap between black and white men and women. Though the United States is more industrialized and has the flexible freedoms that other countries don't have, it's not put to proper use as healthcare is not readily accessible to its citizens. Now we're going to talk about access to healthcare in Guyana. The geographical isolation of communities make it difficult to deliver equipment and services to patients. There is a variation in morbidity by region. The delivery of health services is found in 5 levels in the public sector. One would be at local health posts that offer preventative care and curative care for common diseases. The second level would be health centers. They provide preventative and rehabilitative care. The third level would be the 18 district hospitals, which provide basic inpatient and outpatient care. The fourth level would be regional hospitals that have 717 beds for emergency services, surgeries, and more. The fifth level of health services would be the National Referral Hospital in the capital, Georgetown, which offers diagnostic and special services, along with a psychiatric hospital. Each region has a regional health officer that reports to the Ministry of Health. Location is the biggest obstacle for patients in need of care. In conclusion, the United States of America has patients paying a monthly health insurance fee that will go to the doctors or clinics. Insurance providers will typically cover services recommended by doctors, but often will not cover them. The increased cost is on the rise as more and more is needed for the physician to cover things such as high admin costs. It is not easy to access healthcare, for the uninsured have no means other than paying out of pocket for health expenditures. Guyana's healthcare is on decline. Many things need to be addressed. Education is important but hard to reach, for the isolation of communities is a big obstacle. The geography also hinders the rate healthcare and emergency care can be received. Staff is always an issue, as the shortage has a bottleneck for relying on other countries for clinicians. Funding from the government is never a guarantee, and if so, it often does not cover the entire medical costs. There is a shortage of special care for patients with unique needs. These patients are usually left to the mercy of waiting for the limited amount of drugs or postponing treatment. These patients that need specialized treatment usually go in search in other countries for treatment, if they can afford it. Now you understand the pros and cons of healthcare in the United States and in Guyana. Thank you for listening, and I hope you leave with a better understanding of our healthcare system.